Okay, we'll go ahead and get started. Thank you for joining us today. We're excited to walk you through how CalCAPA has developed and implemented a theory of change, and how you can take this and apply it to your organization to build a similar framework for creating impact. So before we dive in, as Curtis mentioned, if you can type in your name, your organization, your title, possibly in the chat, and we'll be able to, and if you can, as we're doing the presentation, include any questions in the chat. We'll be able to answer them.
Q&A.
And Q&A at the end of the presentation. So presenters, we have Mr. Scott, who won't be joining us today, but he has another meeting during this time. President and CEO of CalCAPA, and then I'll let Curtis introduce himself.
Again, my name's Curtis Gibbs, Director of Community Development. Been with CalCAPA for almost 10 years. And during the course of my time at CalCAPA, I developed 2 strategic plans. I lost count whether it was 3 or 4 community assessments and CAP plans. And I was instrumental at part of the core group that developed the theory of change that we are talking about. Alex?
Yes, thank you, Curtis. Alex Carl, Senior Planning Manager at CalCAPA. I've been with the organization for 8 years. Also Roma certified trained. I've helped the agency with the 5-year strategic plan for 2022 to 2027 strategic plan. I've also overseen the CSBG annual reports, managed city or agency-wide databases in our organization, and I've completed or assisted to complete the community needs assessments from 2019, 2021, 2023, and then recently 2025. So we'll go ahead and jump into the session description. We'll be exploring how CalCAPA has developed and implemented a theory of change to drive strategic planning and community transformation. This session will delve into the process behind our theory of change, highlighting its role and foundational tool in guiding CalCAPA's initiatives. This session will also break down the process from who was involved, what was, who coordinated what, and what was required for the theory of change to be communicated and applied. And then you'll learn how CalCAPA uses our goals, programs, and partnerships around our measurable outcomes. So this session really wants to walk us through how the theory of change strengthens our Roma implementation and informs our decision-making in the organization. Participants will also hear how we've had a shared vision of change that has benefited the agency and improved our capacity to address the root causes of poverty. So whether you're new to the concept of theory of change or you're looking to refine your theory of change in organization, this session hopes to provide valuable insights into how we've used it and how you create lasting impact. So some learning objectives. We'll be going over some learning objectives. We're going to be talking about our services. We'll be going over the theory of change. What is it? What is a theory of change? And then we'll talk about how we implemented our theory of change, which includes a timeline, who was involved, and things like that. We'll also be talking about our challenges and opportunities of implementing a theory of change, so what we've learned during the whole process. And we'll also be providing some examples on how we use the theory of change as a tool for planning and our decision-making in organization. And then we'll be going over our community action plan, which the theory of change a couple years ago definitely impacted or influenced, and how we prioritize our community's needs during that process. And then lastly, we'll just be providing everyone with some resources that we found when we were developing our theory of change. So some learning objectives. We wanted to understand the theory of change. Participants will gain a clear understanding of the theory of change, its components, and how to develop one for a strategic tool for organizational planning and decision-making. We'll apply theory of change in strategic planning. Participants will learn how to integrate a theory of change in strategic planning, aligning goals, resources, and actions to achieve long-term community impact. And 3, identify opportunities for community transformation. Participants will explore using a theory of change to identify and prioritize opportunities for addressing systemic issues and driving sustainable community change.
So welcome everyone again to this webinar. CalCAPA, this year we're celebrating 60 years, like many of you are. Again, we started in 1965. Our president and CEO, who wanted to be here, but he got called away to a meeting with one of the board supervisors, Gregory C. Scott, has been on board here since 2018. We are a private nonprofit. Our budget for this fiscal year is $36 million. Last year we had a comparable budget of also approximately 36 million, but we get $46 million in revenues. We cover all of Orange County, but our headquarters is in Garden Grove. And then where it said 150 employees and growing, well, we're probably stable, and as we navigate all the funding issues right now, but right now we're at 150. So with this pie chart, you can see all of our many different services. We are definitely a multi-service organization itself. We have three family resource centers, one in Santa Ana, one in unincorporated Anaheim, one unincorporated Orange, and then we have one of the large regional food banks in Orange County, and so we have quite a number of food-related programs itself. So when we actually get to our theory of change, you'll see that we've kind of divided it up between addressing immediate needs, responding to crisis, and those more creating lasting change, empowering communities itself. And so some of our immediate need programs that we're most known for is we actually have one of the largest diaper bank programs in the country. Again, our OC Food Bank is, we have 2 regional food banks in Orange County, but we are actually both not just regionally recognized, but nationally recognized in what we are doing. That food bank itself runs programs like a senior food box program that serves approximately 25,000 people. Every single month. We have our energy and environment program. It's probably about a third of those revenues. We're doing LIHEAP, so we're doing utility assistance and weatherization, and also we have a rental assistance program. And then at our Southwest Community Center, one of our 3 FRCs, we're doing a hot meal program. And so in the empowering communities, so we've been really stepped up our advocacy and our education this past year, especially in light of all the potential federal changes we've been trying to navigate and to educate our 6 to 7 member congressional reps. We have education and youth empowerment programs at 2 of our FRCs. We do financial empowerment program. And then we have our healthy homes, our weatherization coupled with home modification and asthma remediation. That's coupled with our CalAIM program, in which we're under contract to CalCAPA Health. And it becomes very synergistic. We've actually provided webinars and talked at the national conference as to how we weave our weatherization dollars with our CalAIM dollars. We have a workforce development program. Again, been focusing on just on our young adults, but also trying to leverage what we're doing in our program on healthy homes. We do nutrition education, although because of cutbacks in CalFresh Healthy Living, we're seeing potential loss of a long-term contract in which we're out doing the nutrition education. And as I said, we have our ECM, our CalAIM, CalCAPA support program. So you can go to our website, you can see all of our different programs. Next slide.
So we wanted to provide a definition of the theory of change. So what is it? And this is the National CAP's definition. The theory of change is a strategic framework. It articulates the core beliefs and assumptions behind the agency's choice of strategies and services. It identifies the systems and activities needed to achieve long-term outcomes. It aligns the agency's purpose, target population, partnerships and actions, and it supports ROMA implementation. by connecting vision, planning, and performance management. So in short, the theory of change really explains why and how an organization believes its work and how it will lead to meaningful change in the community. So why a theory of change? So what it really does is it really helps to simplify a pretty complex system. So it makes it easier to communicate with stakeholders. It brings the whole agency together by highlighting what we share in common, our values, our goals. It also defines the core beliefs and principles that lie beneath everything. So what is who those foundational assumptions were built on, and perhaps more importantly, it opens up space and meaningful conversations about how community action actually tackles poverty. So you see there's a picture on the right, I believe CAP Santa Cruz developed this, and it really is, they developed a theory of change that builds a house of layered services and strategies. So each level supports the next. If you notice there, it leads up to the outcomes, like an asset accumulation, which is really built on the idea of being self-sufficient at the very top. So we'll talk about how we implemented the theory of change. What is it? This is just kind of a brief overview of how we applied it to our organization. It's a shared framework that aligns CAPOC's programs and outcomes that we want to achieve. This framework directly informs CAPOC's 2022 to 2027 strategic plan and the 2021 community needs assessment, which we're developing during the time, making sure that we're grounded in real community voices so that staff, leadership, and our community members were heard during this process. So why it matters, the theory of change clarified how CAPOC tackles the root causes of poverty, so not just the symptoms. It really strengthened our Roma implementation and our strategic planning processes. Plus, what it did was it helped us in real-time decision-making for resource allocation. But most importantly, what it did was it promoted a shared vision of how community transformation is seen across the agency. So how it was used, so CAPOC uses the theory of change to design our programs, and to this date, as Curtis mentioned, it evaluates and our partnerships as well, and it integrates the community action plan, which we'll go over later on in this presentation, so that we're setting clear, measurable goals for that. And it also supports policy change, service integration, and collaboration across different sectors of our partnerships.
So to take everyone back, so Mr. Scott started in 2018, and part of his vision, he realized that we needed to do a new, he wanted to do a new 5-year strategic plan. The strategic plan that he saw when he came to CAPOC was actually CAPOC's very first strategic plan that we did in 2016. When I first started here, we had no strategic plan. Our prior CEO said that, hey, our CAP plan is effectively a 2-year strategic plan. But here in California, CSD said, hey, it doesn't meet the organizational standards. You have to have an actual 5-year strategic plan. And so I was essentially told I had 6 months of work to try and get our first one in place. So we had our first strategic plan in place, and so we started to work on a first one under Mr. Scott's vision, and we were working on that prior to the pandemic. And then the pandemic started, and it was at this point that we decided to think about doing a theory of change right in the middle of the pandemic. In fact, it caught Barbara Mooney by surprise. He said, "What, you're willing to take on a theory of change during the pandemic?" And we thought, what better chance when we have a chance to take a step back and understand what we're doing. And also at the national level, the partnership had just released its own theory of change. And so what better to get support from Barbara Mooney and her colleague, Carrie Gibson. So we actually put a contract in place with outside contractors to actually work with this on it. So what was interesting is, it's a very interactive process as we're doing interviews with staff, with our board, and filling out surveys and trying to understand what we were actually doing. And while at the same time we're doing our this theory of change. We're also, working on another version of the strategic plan. And so then by the time we actually got to our new theory of change, as we're developing it, we realized, we need to go back and redo it now that the pandemic was drawing to an end, and try and tie a strategic plan back to our theory of change itself. And so, as you can see there in the note, that we, with regard to trying to involve CalCAPA at all levels, senior management, line staff, we moved through all the different questions that we needed to answer to better understand what we were doing. Next slide. So what you're actually seeing here is the final product. What it doesn't really illustrate is the process that we actually went through to get there, because this is the graphical interface. One of the things that the consultants told us is, well, they'll help us develop it in the narrative format, but we, with our own graphics art department, will have to figure out how we want to depict it. And we went through actually many different variations trying to think about the best way to show this theory of change. We had, but even at the same time we were doing this, we had another consultant on board, and we were going through an actual rebranding process. So at part of the rebranding process, we were also then taking a look at our vision and our mission at the same time, which then came together with what we were doing here. So on here, you can see our main values of EPIC: excellence, proactiveness, innovation, and collaboration. This was a paradigm that Mr. Scott brought to our agency, and right below that we kind of put in our assumptions as to what we were working with. Then towards the bottom there, you have our strategies, immediate changes, and transformational changes. And we started to line up the different programs that kind of fell into that, so we have an understanding as to how we could move people and get families out of poverty. So at the very bottom, you can see the tagline that our branding ended up with. This is where poverty ends. So that this here is just it's the same thing what you're seeing there. It's just a bigger slide for us to be able to see some of the things that stand out. So a lot of these are some of the things that you saw at the very, very beginning with regard to addressing immediate needs and empower communities. But then you see the immediate changes. And so by actually going through this process, it actually helped us better understand this. So what are we trying to do relative to bringing in funding and relative to the programs we wanted to implement? And also, feeding into this was our community needs assessment that we were actually doing at the same time. So here, this in some ways is like a step back, because this kind of shows you what the building blocks that we had that we had pulled on together and trying to get to that end product that we were then sharing. So there was a lot of moving pieces. It took many different iterations trying to figure this out as to what would fall in where, what was in, what was out, and then how we were going to graphically depict it. Anything you want to say on this, Alex?
Yeah, so if anyone is familiar with Roma, this probably looks a little familiar, kind of looks like a logic model. We have our assumptions, and we have, how we're going to achieve some of our results, and then of course, what are going to be some goals. So, but yeah, that was also too, I should mention that the staff was also surveyed during this process. So it was really to capture everybody's voice in the organization. So it was also surveying our assumptions about poverty, services, and how we hope to move people out of poverty. So I wanted to go over some of the challenges and opportunities that we found when doing our strategic, our theory of change, I should mention. Next, we want to, the discretionary funding is kind of something that that we utilize, but we realize that different organizations may not have discretionary funding. Do you want to
Yeah, again, every year there'd be a small amount of discretionary funding that you could use. for capacity building. So this falls under capacity building. So
Also, too, capacity in your organization is key. While we have a planning department, we realize that some organizations may not. Sometimes it's just one person doing many roles in the organization. So when trying to implement a theory of change, definitely understanding your staff's expertise, capacity, time is definitely important. And then, of course, how you're going to involve your board, your leadership during this whole process. And then also, too, one thing that we found, we were also doing rebranding, but we were also updating our mission and vision statements. So this process might actually trigger something like that. So it might require you to reconsider some of your programming, your mission, and your vision as well. And then also, too, logic models, as used in Roma, are very helpful during this process. I mentioned it really puts everything together, and you can take a step back and look at the big picture from an agency point of view. And also, too, in the local theory of change, the agency's own needs are your outcomes and strategies, of course, should be incorporated during this whole process, as we mentioned.
So by us developing our theory of change, it actually really set us up to be able to compete for some significant grant opportunities. So we essentially just finished the theory of change when we took a run at the County of Orange whole person care, which led to CalAIM. And so it helped us to how we would present ourselves and how we were attempting to do case management, housing navigation. And what was interesting is when we went through that competitive process, I mean, what we were competing for, we hadn't really done exactly what they were asking for, but we knew we could do it. And I think in some ways, having completed this process helped the county realize that CalCAPA would be perfect to be able to start doing the whole person care. And then again, when it moved over to CalOptima, our Medi-Cal provider, and we essentially started taking on all the other community supports. And that's where you see and then we became a trusted contractor with CalOptima, and we were able to compete for funding there to be able to enroll more people into CalFresh SNAP and Medi-Cal enrollments as they under the current state when they decided that they wanted to reach on out to those who did not have health insurance. And then at the same time, we actually did the original theory of change. We were going, and this was going back 5 years ago. We had the opportunity to compete for Families and Community Together from the County of Orange. We had won a grant like that to help support our El Medina Family Resource Center in Orange. And it was really important to try and bring that into Anaheim. And again, having this paradigm and having this sort of method as to how we were moving those out of poverty, I think really helped us get the background for Anaheim. And then we just got that grant renewed for a second time, along with our back grant for El Medina. Next slide. So when we did this, there was kind of like we were really setting ourselves up for the sort of things we wanted to take on over the 5-year period of our strategic plan. And virtually all of these items that you see here kind of would fall in underneath one of those pillars in our theory of change. So one of the things we took on was to actually inventory our real estate assets and try and think about how might CalCAPA do more in the housing realm. We actually have 7 units of low-income housing. We own five housing parcels and the land under all our 3 FRCs, and also a child care facility that we lease out to another entity. But anyway, we actually took a step back and started analyzing what those neighborhoods were like and what was the possibility as we looked at possible doing more in the housing realm. And that was a major study that we started at about the same time and completed, and we started to think about for a few years. And then workforce development initiatives. So we keep seeing RFPs for workforce development opportunities. We get close and we don't get funded, and we try again. So again, it's a lot of young adult workforce. We're trying to get funded. We get funding from corporations and foundations, but we're still looking for a major government contract to be able to continue to do our workforce development. But one of the things we have worked towards, as we've been doing our CalAIM program on our healthy homes, our asthma remediation and environmental modifications to the home, we realized here was a whole opportunity to be able to do a apprenticeship program. And so we've kind of been looking for funding on that, and then we recently got funded to do a pre-development dollars to be able to scope on out to build a workforce training facility to try to understand what it is, so that we might be able to do a pre-apprenticeship program, a full apprenticeship program for weatherization. And then at about the same time we were doing our journey of change, was our realization that CalCAPA, well, we needed to think about our own employees. So we took all of our employees and brought everyone up to $23 an hour. And so some of our warehouse employees, that would have been a significant jump from like $15 to $23 an hour. Next slide.
Well,
So before you start, so one of the, right before Alex goes on this, so when we were doing our community action plan, I think the one going back to 2022 or 2020, so we'd be asked to take the community needs that we were seeing based on community needs assessment and to rank them. And our board said, well, how are we supposed to rank them? Go ask CSD. So we went and asked CSD. So how do you go about ranking what you're seeing in your community needs? And they said, well, rank them against your strategic plan. Well, our strategic plan at the time, our original one from 2016, wasn't very useful. And so we had to go through another process to try and rank those communities. But once we had our new theory of change in place and our new 5-year strategic plan, this became a much more orderly process.
and then also too, as Chris mentioned, the CNA was happening during this time, but a lot of those needs kind of informed the foundation of our strategic plan, reviewing existing data, of course, and understanding best practices that supports the goals. So for the community action plan, we use the strategic plan and the needs to rank our top priorities. And you'll see there on the right is what we submitted as part of the community action plan, where you see the agency priorities that are on the left, which were from our CNA. And then of course we have all of the different indicators for the CSBG. And then why the need is a priority. We had to provide a description, and also we took directly from our strategic plan that we had developed, where you see the drivers there and our goals. You want to add? Yeah. So next, this is actually an exercise that we did with our board and our senior leadership, where we asked to rank our strategies from our theory of change. So there on the left, you'll see there for example, establish economic stability and alleviating hunger. These were strategies that were taken directly from our theory of change, but it really helped to drive what our agency prioritized at that time. But I guess in looking at our current programming, it still holds. So this is a very interesting exercise that we did. But if it wasn't for the theory of change, it would have been a lot more difficult to do. So it definitely helped us during this process. Okay. And then here's another table where you see there the theory of change strategies on the left. And then with the scoring, with priority as 1, all the way down to number 9. And then we were, as mentioned in our community action plan, included the types of services that we currently, or at that time had, and also provided some guidance as to, if we don't have this service, then, let's go after some funding, so that we can, develop some of our programs that we eventually did, as you mentioned, with some of the some of the programs that we developed, as Curtis had mentioned, in the years after. Resources for creating your theory of change. We found the National CAP, NASCAP resources to be very helpful during this process. We also know that some of our local CAP agencies, giving kudos to our fellow CAP agencies in California, CAP Santa Cruz and CAP SLO had some really great material that we were able to pull from online. And just the materials in general, there's a lot of how-to guides, as you notice there from the national CAP to creating a local theory of change. There's also interactive theory of change that we found using Prezi, which is like a presentation website. And then, of course, any guides that we found that we came across on creating the theory of change. There's frequently asked questions and some videos that you can find online that we found very helpful during this process. And we can go into questions. I know our colleague.
Yeah, we should check what's in the Q&A or on the chat. I'll bring it up or have you send to read them to us.
Yes.
No, I'm gonna say no questions right now. Not that I've seen anything pop up.
Just take questions from.
Okay. We can open it up to anyone that has any live questions that we'll answer. We'll stick around.
I'll bring up the gallery.
Yeah.
As folks are starting to think up their questions, this is Lawrence. I am curious about when you all decided, hey, yeah, we want to move forward with this theory of change. Like, what were some of your first steps? Like, who did you reach out to for assistance, or how'd you get started? Like, if I was saying, all right, I've not done this before, what would be my first step or first couple of steps to get things moving with my people?
For us, I think it was the decision to bring in outside help. So knowing that Barbara Mooney had just completed the theory of change for the partnership, which was their first theory of change, that we reached out to her and asked whether she was available and what her cost would be, and then tried to figure out whether we could afford it or not. And then it was with that, then it was a process of I wouldn't call it negotiate, but discussing with her as to what the steps would be, how long it would take, who would be involved, and she helped us lay out the entire process for us.
Nice, that's good to hear. If you're curious who Barbara Mooney is, Barbara is the sort of the director for Roma right now, the association that certifies all of us Roma trainers and implementers. Barbara Mooney oversees that whole operation. So very valuable person to have in the room when you are venturing out to set up a theory of change.
If I may, Lawrence, when you're sitting there and saying, yes, I want to go do this, Curtis is right. First, you want to see who is available to help you. And that could also be another agency. It doesn't necessarily have to be Barbara's team, because she does come with a cost. But then you also want to make sure that your president and CEO is on board, and ours had full backing, because this is a time sink, and you have staff being pulled away to focus on getting this done. So you want to make sure that everyone understands going in that this is going to be a multi-month project with a lot of questions and start-stops. I believe, Curtis, that final version we showed in the slide deck was version 14, because you will go through lots of semantics, lots of feedback, and you have to have broad shoulders and say, okay, well, let's take that back to the team, the core team, and rework it again. But that's all also part of the process to make sure that what's on the other side is something that's usable.
I also think this exercise could be something that would be done as part of standards of excellence, which could be a way to be able to get feedback from the partnership at no extra cost, other than what one would be paying to go through the standard of excellence levels. Because at some point, you can really enhance yourself on how a CAP agency is evaluated to be able to have a theory of change in place. So, and I would strongly encourage any CAP agency to consider doing the theory of change about this either before or about the same time they're doing their next strategic plan itself, because they really feed into each other.
You mentioned that this was a very valuable tool during your strategic planning process, that it saved you a lot of time, if I remember right. Are there other ways that you have found value in this local theory of change, whether it's the document or the process or anything about it?
Well, the diagram you saw, we've included it actually in several grant applications, and we just inserted it as part of it, and we probably also inserted it when we've been going after foundation funding or corporate funding, because it really demonstrates that an organization has a plan in place and knows what the overall process is as to moving those along the different steps of sustainability.
Yeah, I would agree with Curtis that it has opened some funding doors, but even before that, the reflection it required really gave the agency focus, not just what we currently do, but what we want to do, and then just as importantly, what we're not going to do. And that really gave our development team guideposts to say what really fits into what we want to chase funding wise and what we don't. It's also been, you may not think about this, but it's been super helpful in our new board orientations. It's the one slide that comes up that people pause on and go, oh, okay. I get the agency now. After multiple slides of multiple program lists and what we do and how many people we touch, when we get to that one, there's always a kind of a recognition of, yeah, okay, this is what I'm signing up for, and this is what I want to help.
I got a question.
Yeah.
I see your challenges you guys had on the slide. And you said you had many revisions. Throughout the many revisions, what were a couple of primary roadblocks you guys occurred or came across during this process? Because I know it's quite a bit.
The many revisions that Bill's referring to was on the graphic interface, and so just thinking about how to lay it on out, we kept looking at different formats and what fit where. But even before we got there, we were trying to think of, okay, as to the things we're doing now, I mean, what's actually there? What aren't we doing that we would like to be doing in the future, and where might we put those? And so there'd be significant discussion there, and then there could have been programs that we're doing that maybe we don't want to put them in the theory of change. Maybe they don't fit as to when you're looking at how we want to transform capital C over a 5-year period. So there was a lot of thought and effort as we looked at each one of those stacks.
Yeah, Pete, I think, again, the reflection it caused pulled some things off of our strategic plan that were originally there, because we decided that these things we landed on were the most important for the agency to focus on. And, like most nonprofits, everybody wants all their programs on to be seen. So at first, when you start designing this, everybody wants everything on there, and you wind up with, 0.5 font, and you're going, wait a minute, this is not this is not a workable document that we can use. So there was a lot of discussion about, as Curtis said, what are we doing now? What do we want to do in the future? Let's make sure that's captured here. And then really that immediate needs and empowering communities piece was enlightening, because then we started lining things up and saying, hey, this is what we do for people in the immediate period of time, and this is what we do for people in long term, and started lining programmings up against that. And then when you start looking at that and comparing it with your budget, you realize, wait a minute, we're too heavy over here, or too light over there. And that was super helpful. It was a difficult process, because as they said, we were doing the community needs assessment at the same time, but we were able to take some of those elements and also put it in, match that up. So we felt really good about the process, but there was a lot of talk about what programs should be on the theory of change, what the assumptions should be like, and there was just good, solid dialogue that went back and forth. It takes a few iterations to get there.
One of the major discussions we were having in our first strategic plan, there's nothing there with regard to CalCAPA providing any sort of housing, even though we have 7 units of low-income housing. There's nothing there with regard to our role within the homeless problem in Orange County. And so when we were doing our new strategic plan, we started to think about, those two, let's call them opportunities, or where do we want to position CalCAPA in that? And so trying to figure out, even on the low-income housing, as to those who are unhoused, I mean, was there some sort of magic number as to what we were trying to work towards, that we felt during this overall period, that we could position ourselves towards? So, but the main thing is we kind of softly went into trying to work doing housing navigation, because we were just beginning to be contracted for these activities. So we started to understand our strength of being able to navigate unhoused into permanent housing. And I mean, since then, we've actually placed probably close to 200 people that have been unhoused into permanent housing through our CalAIM program. And we've actually now taken on our potential new construction for an 8-unit supported housing project.
All right, we're happy to take a couple more questions here as you have them. I'm also interested in continuing this conversation at our conference. So if anybody wants to take some time during the CalCAPA conference, we're going to have like an open kind of study room where we'll focus on topics at a time. This may be one of those topics that you or folks at your agency might be interested in talking more about, after you've had some opportunity to digest this information. Beautiful. Any other questions for our friends at CalCAPA? All right. Well, you're getting thank yous in the chat, so I think that might be our cue to wrap up our session for today. As I mentioned before, you all receive copies of the presentation and the materials. As we close out of this, you'll get a survey to take, a simple 1-question survey. We really appreciate your feedback. And for those that are anticipating going to the conference, we'll see you there. All right, folks. Have a good one.